transplants were initially being done for ages above 45, 20 years back. Hard water is going to cause a lot of hair loss. Lot of youngsters, they think skipping meals can reduce their carbs.
Yeah.
And then, they can become thinner. But they should understand when they become thinner, their hairs are also becoming thinner.
Hello and welcome, guys. Welcome back to another interesting episode of our podcast. Today we have a very interesting guest, Dr. Raj Kirit. He has his own practice called Celestee Skin and Hair Clinic here in Hyderabad. Very experienced personality, and hopefully we'll get to learn a lot of new things from him today. So welcome, and please, for the unaware, we want to know a little bit about you.
Thank you, Fazil. First of all, it's a wonderful studio that you have here.
Thank you.
So this is me, Dr. Raj. I'm from Celestee Skin Laser and Hair Clinic in Jubilee Hill. I did my, I started my clinic long time back, and then slowly I've evolved it into a bigger space of around 7,200 square feet, dedicated to skin and hair. It's all about skin and hair. So this is me. So
what made you get into this field and not something else? Maybe like engineering or something more, socially acceptable as to the time when you studied?
Well, yes, Fazil, when I was a kid, I had only two options, either to be an engineer or to be a doctor.
Yes.
There was no other option at all. You know, like today's world, there are so many things that you can innovate, you can do something, you can create something for yourself. Those days, it was only two choices, two fingers,
Yes.
You choose either of it, that's it. So engineer, already my brother was an engineer, so I thought probably I should do something different, and I was more interested into science.
Okay.
I was good at maths. A lot of doctors, usually they're scared of maths and they get into science.
Yes.
But I was very good at maths and I was good at science. But I wanted to be a doctor so that, I can do some good work to the community, social work kind of a thing. Yeah. So I ended up being like.
And what made you choose this particular subject?
Well, it's not that I had been given a choice even at that point of time. I was given two options, anesthesia and dermatology.
Okay.
So I just chose dermatology because anesthesia was more of a thrilling subject. But dermatology, it so happened that, I thought probably it has more scope and I can do something better in that. And I chose dermatology. But when I went into my post-graduation, and then I went to my first conference that was in Vizag, then it opened up my eyes, it made me realize how big, how vast is the scope for dermatology, for the skin and hair. It showed me the different avenues for that,
So your first conference was in which year?
This was in year 2006.
2006. So, but back then, there were not many patients who were ready and open. Dermatology was more like, somewhat a taboo, you can say, back then.
Yes.
People are afraid to visit and share their insecurity. It's more or less sharing insecurities with the doctor when it comes to your field. So from that to now, it has completely evolved. So Could you foresee that back then in 2006, or it was just like a guesswork for you, or what was it like?
Nope. I couldn't see that coming. In the year 2006, the outlook of dermatology was only, certain skin issues, non-contagious skin issues, which were not like, get in contact with someone and then you'll get the contagious thing. So patients had a perspective that skin and hair issues were basically only related to chronic illnesses of the skin. But then there was a phenomenal change in the outlook of dermatology patients. Now people come to dermatology clinics just to get themselves look better.
Yeah. They visit you probably more than they visit their dentist or a chiropractor.
Yeah. Now the dermatology clinics are coming in so much in number.
You can more realize, than saloons, in fact. Right now. Aesthetic clinics and God knows what they're calling it.
Yeah, recently one of my friends was commenting that, dentist, saloon and dermatologists are everywhere. But yes, the demand is growing so well.
Yes.
People are understanding that there are options and therapeutic probabilities that they can look far better than they were before.
Yes.
And people are becoming aware of the skin issues, what they are having now. Earlier, it is that someone else had to poke them, saying that you could have gone through that, you could have done this. But an easy access to information.
Yes.
Thanks to social media, And there's a lot of bombardment of ads of saying that you can look better with using this serum, you can use that serum, Youngsters are trying to look, for a genuine information kind of a thing. So that's where, they are getting aware, but then they're looking out. Yeah. So the awareness has increased a lot. And that's in a way good way to both for the clients as well as for the clinics too. Yeah.
So which year did you start your practice in?
Well, I started my practice around 2013. That's almost 9-10 years from now.
2013. How confident were you going into starting a practice? Because even 2013, the market was still getting mature. It wasn't as mature as it is today.
Yes.
So I'm sure you had your own fear of whether this thing is going to fly and how long you have to, hold on tight to it.
Yep.
So what was your mindset like taking that big step?
Well, I was an employee until that time.
Yes.
I tell you, I passed out in the year 2011-12. And then I was an employee. I was working under two good senior dermatologists. They are my mentors. I don't regret it. They were my best mentors and I had my best time. I worked for 5 years with one of the senior most, very nice gentlemen. And then another dermatologist was my teacher during my PG days too.
Okay.
So both of them were my teachers and mentors at the same time. So I worked around 8 years with the other guru. So 2 gurus for me, like 2 eyeballs, 2 eyes. You can't say which one is what.
Yes.
I say that they are the best for me. Well, yes, after that, then I took a bold step of starting a clinic that was around 600 square feet. 300 square feet in the first instance. So 3 rooms, 1 consult, 1 procedure, and then a reception. And a seating area with some pharmacy for some medicines. And then I added another room after a year that took around, that made it around 600 square feet.
Okay.
And then, during the 2016 time when there was demonetization, the space was left vacant. And then I could get an opportunity to expand. I was really skeptical.
Yeah.
Can I fill this up? 3,500 square feet is too much for me to handle up. And then I took it up. And then afterwards, now, we made it to 7,200 square feet, and still we are feeling short.
Plenty room for me to wait.
So now we have changed now. So we have moved from 300 square feet to 7,200 square feet. But yes, it was a bold decision. Of course, my family and friends pushed me to it, and they encouraged me. And yes, now today we are doing a great job.
As the business matured, you started obviously to get more busy, right? Handling the patients and the administrative part. How did you make time to upgrade your knowledge at the same time? Because as the market evolved, more problems in humans started showing up, I'm pretty sure. So how did you find time to upgrade yourself at the same time upgrade the business?
Well, it's a very constantly evolving phenomenon, Fuzel, I'll tell you that. While I was doing my PG, I tried to attend as many conferences as I could. And these conferences are very, very good places, platforms for us to exchange informations, People perceive as doctors' conferences as a party kind of a thing, They go there, they do parties, they get freebies, everything. But there are many doctors who can actually go to the conference, they share the knowledge, they gain lots of knowledge, they evolve themselves, they evolve the perspectives of the dermatologists as well. As if I go give a talk on hair and I give an innovative approach to hair loss, then suddenly everybody starts to think in that way, saying that yes, probably we should look at it as well. So attending conferences, upgrading our knowledge opens up our
thinking horizon.
Thinking and our perspectives also. It widens us. It's not like a tubular vision that we should have. We should have a wider vision to accept things. So these conferences help us that way. And then, of course, I was constantly presenting in those conferences. I was presenting as a small-time posters, tiny posters, you give it to the dermatologist saying that postgraduates, okay, be happy posting something there. So I did several of them. I used to go to the conferences, I used to stay in small time hotels because I couldn't afford it at that time. So I could just stay there and overnight, and then I could go there, stick up the poster and say, take a photograph and say, oh yes, I presented, and then post it on Facebook, social media, and then my friends say that, oh, okay, you've done a good job. Then, of course, then came the time, then slowly those posters became some papers. So I could do some studies and then I can present them, rarer case reports. Then I presented there. And then I started then posting photographs again, and then showing off, saying that I was on the stage, I got onto the stage. Meanwhile, it was a constantly evolving process by scientific way.
Yeah.
People see it like, doing something like that. But every time I present, I refine myself. So every time I present, someone criticizes me. That's the point of confidence. You point out something which I didn't cover it up. I still remember an HOD from Safdarjung Hospital, Dr. V.K. Ramesh sir. He's a very, very nice gentleman. I presented a paper which I did a fault. I did a mistake. And then he openly said that, doctor, you have that particular point over there. How could you miss it? But you're mentioning this way. Then I was embarrassed. But, learning from that embarrassment, I made sure that next presentation was more refined. That I should be more perfect, So that way I started evolving, and in the conferences we learn and then we do that. And then we learn from mistakes. Yes. I learned from several mistakes. I still do mistakes. It's not that I'm a perfect gentleman now.
Okay.
My teachers taught me that. Even at the age of 60, 65, they still go to the books, they still go to the net, they still go to the best journals. They upgrade themselves, they get back to me telling that this is the point, probably we should look into that. Several things that my teachers have taught me and I have been implementing today, and I'll continuously implement that. So if we are not evolving any time in the business, be it anything, that's what I realized. The best guys whom I spoke to, different commercial aspects, they always tell this thing: cease to learn, cease to exist. That's my policy. Cease to learn, cease to exist. You shut down yourself saying that I am the best, I know it. That's it. That's the start of your downfall. So that's what I feel. Even now, in the next coming week, I'm going to a conference where I'm going to present, I'm going to talk, I'm being the expert, I'm being on the panel. But I'm going there to learn something too. Yeah. Some topics is my interest. So now I'll go there, sit down, study something, read something and do that. So this is a constant process where I evolve my knowledge, and there's a lot to do.
Yeah.
And then, of course, when you see about my clinic, upgradation of my clinic, well, that was a very transformative process. Even that one went from a small time laser machines to, big time laser machines. Now we have the best machines in the world. I went to Israel, I went to the other countries. And I've seen them using the same machines what I have been using in my center.
Okay.
I know that, yes, this is my good quality machine and I'm giving them at Indian prices. And, I'll tell you one thing. One of the most advanced laser hair removal machines, we launched them in South India first, before Bangalore and Chennai could do it.
Oh.
I was so passionate to bring that technology to Hyderabad, so that, I should be the first one to do that better than, Hyderabad can do far better than Bangalore and Chennai.
Yes.
Why should we tie ourselves down, So I brought that, apart from bringing them, it's not the commercial aspect which I did there. We worked on a study. And we published that in an international journal.
Okay.
It took us around 3 to 4 years where we did a study on how many patients that we could get the best result and how it is safer. So now when we publish this in the international journal, you should realize that this is the first journal on triple wavelength.
Okay.
It's a different technology. Any laser hair removal will have one single technology. It's one single diode technology or a wavelength.
Okay.
So 810 wavelength. So in our machine, we have triple wavelength, that 3 wavelengths, 810, 1064 and 755, which comes and targets different levels of the hair follicle. So for using these 3 different wavelengths, we need 3 different machines. So instead of that, the company guys brought it into one single thing. So what we did was, we did a study on that and then we published it. When we published it on the triple wavelength, this was the first literature in the entire world.
Oh, wow.
So imagine, scientifically, it's not a commercial aspect to it. Scientifically, a person in Hyderabad, a doctor in Hyderabad could do that job. What Indian doctors can do? They can do several things,
Yes.
So, it's not, I wanted to take it as a challenge, saying that, can I do this? So I brought it for the first time in South India and then I published it and then the whole world is citing me now.
Nice.
Any conference they go, they talk about laser hair removal. They cite Dr. Raj Kirit et al. That's how they do it in scientific conferences. They say, this is a publication which was there on the triple wavelength. Now there are many publications which are coming up.
Obviously.
There are many. So, things are good in that way. So it's not just evolving in the commercial aspects. Technical aspects, everything is a byproduct next. So I try to maintain the quality. There are some ups and downs, about it, as a challenging thing. We as doctors, we are never trained to manage clinics for sale. I can tell you that.
Yeah.
We are always trained when we say that how to evolve ourselves, how to run the administration. My teachers in my undergraduation college, they used to tell us, why you are talking about that? You read books first, you pass. Don't talk about that.
This is a completely different aspect. They cannot teach you.
Yeah. So when we tell them as business, they become like, Barzak.
Yeah.
You talk about business or commercial aspect. You cannot dare to talk like that. And then, suddenly you're thrown out of the medical college and parents say, Kab kamaega tu?
Yeah.
When will you start earning? Your friend is bought a bike. He has already bought a bike. He's going in a car. He's having his phone. And how come you're asking for your pocket money? Yeah, it's a terrible time for a doctor. I'll tell you, when I was 26, 25, I was still asking my parents for my pocket money because I didn't have a source of money.
Yeah.
There's a word called as relative poverty for doctors. I tell you that. Their ego hurts, at the age of 24, 25, and they have to go to their father, mama, money, I want to buy something. Like, why? So it's a different way that we change from then to now, But when you say the commercial aspects, it's very important for us to understand that technology comes at a price.
Yeah.
So when I'm trying to bring a very evolved and highest technology to our center, it comes at a price. And especially when when we bought that machine, we had to go through lots of financial issues. We struggled a lot, and then we did that. But today, if you see, a lot of dermatologists and a lot of cosmetologists and, a lot of practitioners, skin and hair, they started doing these procedures, and then they're evolving. This segment of medicine is doing really well. I will say that openly. It has taken a little bit deflection from what it has supposed to be being, but it's good for the patients and the clients and the doctors as well.
It's basically catering to the need in the market, right?
Yes, if you're not, someone else is doing a low grade work.
Yeah.
If I would say that I will not be doing the laser cosmetology because I'm far more qualified, I'm far more experienced, I'm far more ethical, whatever terms you can tell them. But the other one, who's not even a doctor, is practicing that.
Yeah.
People who are it's not fair. They end up giving problems. It's better that we embrace that rather than fight it. And you embrace it with quality, embrace it with good dedication and commitment to do great service. I think you can do a good job. See, even though we do laser hair reductions and, certain medical procedures with lasers, patients are so satisfied.
Yeah.
I can tell you, there are two ways to look at it, clients and patients. We look at it in different ways. People love themselves to be called as clients rather than called patients. For them, it's a flexible term. It's all about, how you're being treated for, basically. There are many girls, I'll tell you, many women who have so many hairs on their chin and they never understood the concept of laser hair reduction. All throughout the years, they were really suffering, and then they realized that there is a thing called as laser hair reduction. They can get it done. Imagine a woman who's getting laser hair reduction at the age of 36. All through her younger years, she had suffering with that.
Used it for over a decade.
Oh my God, I'll tell you, I had so many photographs. The paper I published in International Journal, the publications, I tell you, those photographs itself are an example of how much trouble they're undergoing. But we have brought the technology, we have got it here, and we're giving those results. It's a wonderful thing.
So, now another aspect that I'm pretty sure you face your clients coming to you with is hair loss, which is very prevalent in today's society, especially with men.
Yes.
So, what was the scene for hair fall and people approaching you for it back when you started the practice to now? How much has it changed, and how much do you feel are the reasons also of it happening have changed?
Well, if you talk about hair loss, Fazil, we can go on for days. I can tell you that. See, if you talk about the days in 2006, the hair loss was not a major problem back then.
Mm-hmm.
I would say it was a more of acceptance rather than saying
Being
that
viewed as a problem.
Yes. See, the thing is, in the years of 2006, 2008, 2010, people perceived baldness as a permanent thing.
Yeah.
Now people understand that the hair loss can be stopped at an early stage, and they can seek for therapies, and they can postpone their baldness. They can do hair transplants. They're very much open to it now.
Yes.
Because of the social media, I'll tell you that. And there's a lot of, marketing going around with the hair products and everything. That's the thing. One thing I'll tell you, Fazil, there's a saying in our textbook, when the civilization is flourishing, they look towards the aesthetic segments more. So in 2006 and 2008, when I started my post-graduation and the days when I was consulting, hair loss was not much of a significant issue.
Yeah.
And they used to accept it. But when people started getting, flourishing, they started getting their incomes and they're in a higher side. Now they want to look presentable.
Also with technology, I feel, because people's expectations are this: if we can send something into the space, then we can very well grow hair on our head.
Yes, they can. But yes, there's a limitation too. Yeah. There's a disclaimer too. Yeah. There's a limitation. But yes, people can start growing hairs. They didn't realize until that point of time. Now they're able to realize. And they come here, those days were the days when I started, PRP, platelet-rich plasma. That's a buzz thing,
Yes.
We were the first ones to launch in Hyderabad, in the center though. When we launched for the PRP, people were dumbstruck, They said, what is PRP? What is platelets? What is rich? What is plasma? What is that we are talking about?
So were they just inquisitive about it, or were they skeptical of trying it also?
They were like, absolutely no. No, they were no. What is that PRP? My blood? You're taking blood? How much blood? 10 ml? 10 ml blood? I am very skeptical to give 2 ml for my blood test. How can you take 10 ml? No. Actually, it's 30 ml, 40 ml. I'm taking only 10 ml. No, doctor. Nothing with blood. Those things used to be the conversation at that point of time. But for the past 4 years or so, Fazil, patients come to me and say, Doctor, can we start PRP?
Okay, they come to you with the treatment.
Yeah, they come and tell me PRP. I was like, you know about PRP? I've done enough research, doctor. You don't have to tell me. I'm okay. We'll go ahead. And now it is like, they get the PRPs done already, and they come back for the rotational therapy, the repeat therapies. So now it's a job easier done. I don't have to explain much about it. It's only that I have to maintain the quality of PRP, and it works wonderful. It's all about protecting your own hairs, and people have started perceiving that, starting to protect our own hairs is a better option.
Yeah.
Rather than going for transplants. Transplants are very good. They give wonderful results. See, I do roughly around 7 to 8 procedures, hair transplants in a month. Probably we're looking at more numbers too. But the thing is, when we are doing those transplants, it's a very transformative process for a patient or a client. They change their looks completely.
Yes.
Yeah, it gives them a lot of confidence. Yesterday, I've seen a patient of mine, a client of mine. He's got his transplant in the last year. You won't believe it. His look was so transformed, and he looked so handsome.
And the entire demeanor changes, right?
Everything changes. The confidence, the way they carry themselves, it changes. It's a very transformative procedure, And even girls who get it done, women who get it done, their confidence lies in that. A lot of guys and girls, it's all about youngsters. Even the other day, I did a transplant for a 55-year-old gentleman.
Okay.
Transplants were usually being done for ages above 45, 20 years back.
Yeah.
10 years back, it was to 35. Now, we are doing more of 25s. Anybody who's about 24, we do transplants, if at all they require that. Youngsters are coming. And I'll tell you one very open thing, this is something which is hurting, sometimes it is hurting, but these are the facts. There was a guy who came to me and he said, Doctor, I want to go for transplant. I was like, see, the transplant is like, you're supposed to do this, we'll trim your hairs, then we anesthetize that. And it's like, this is the process, this is how it is. When you want to get it done? Tomorrow. See, tomorrow we don't have a date, probably day after tomorrow. Okay, he goes for it. He goes for it silently. I keep asking, I try to be more comfortable to my clients, talk, make them look more reasonable, so that they can get into the rhythm of it. Then he goes off like, okay. And I said that you might have a little bit of discomfort while I'm injecting anesthesia. And I'm like, okay, fine, he's okay. Go in, punch. I keep asking during the procedure, where are you from? Like, yeah. And where are you working from? In so-and-so company. And there's the so-and-so. That's it. It was like, 1 word, 2 words, 3 words and so.
Okay.
And then it so happened that, in those days I used to do the entire procedure. Now my team does it. So I used to be until like 4 p.m., 5 p.m. Then I go and then suddenly the outpour starts.
Okay.
Doc, I struggled so much. I turned from one end to the other one, making ends meet. When I was 19, 20, they told me, if you want to get married to a good girl, you're supposed to have a good house, good, car, good salary, good pocket, good bank, everything. After getting everything, I went to the match, Alliance, then she told me her mom rejected me. It's
It wasn't a transformation. It was more about redemption.
Redemption. He wanted to look his own self.
Yeah.
All he wanted was to look his own self. He said, I lost hairs trying to get that, and now I'm getting these hairs to get married. So but that is what I'm saying. Girls are becoming demanding. That's a good sign. It's not a bad sign. It's a good sign. And they look pretty well too. It's not that they're not this one, and they're pretty achieving well too. They are getting jobs and everything. So there's balance, and they are expecting them to look presentable.
Which I feel is good. There is a balance. Both the genders are kind of pushing each other to do better in every aspect.
Yes, they are doing. Now, I see couples. I see youngsters. They want to have a balanced approach in life.
Yeah.
Way back then, it was only, a race kind of a thing that, you're supposed to do this thing, you're supposed to achieve this thing, you're supposed to get a goal and this one. Now, the perspective of the youngsters have changed, saying, they're looking at a well-balanced approach in their life. And that's what is encouraging me to, do procedures for them, get to them to reality, saying that PRP is not going to get you new hair, but hair transplant is going to get. But you can postpone hair transplants just by doing PRPs and using those medications. And because they are safe, how safe they are, it's all about our perspectives. And it's always good to prevent in healthcare. I can tell you that, Fuzel. In skin and hair, it's all about protecting that.
So we've done speaking about your journey, skin, hair, everything. Now, I want you to make our viewers aware of the fact that before medication, before all of this, maintaining a certain lifestyle, consuming the right things is way more important. How does it have an impact on all of these things? Basically, I personally feel that everything that shows up on your skin and on your scalp and everything is basically a end product of the things that are happening bad inside your body. Right? So can you shed some light on that?
Rizal, the biggest problem I'm facing these days is lifestyle. See, lifestyle wellness is one of the things which is around all throughout the world now. It's because the lifestyle has gone for a toss. The skin and hair problems usually related to hairs, these baldness and androgenetic alopecia, they're all preponed. It's more of genetic reason.
Yeah.
Someone in the family has a gene of baldness, so that's why they lose the hairs.
Yeah.
Now, what happens is their lifestyle goes for a toss, and then they prepone their baldness.
Yeah.
So that is the main reason why you have seen more youngsters losing hairs rather than the oldies are losing hairs. What I'm trying to say. See, the thing is they don't sleep in time, and then no nutritious food. I can tell you that. And frequent change in locations. People from Hyderabad go to other places, Bombay, Delhi, they come to Hyderabad. Chhattisgarh, they come to here, we move to Chhattisgarh, Jharkhand, Ranchi. Lots of things are happening. Especially when you go to places in UK and US and Australia, there they are only processed water.
Yeah, hard water.
Now that hard water is going to cause a lot of hair loss. So what happens is that these lifestyle changes, stress adding to it, and people perceive that, waking up late into the night can be, will help us achieve more working hours or more partying hours. Those things can relax us, but it's actually taking the body for a toll.
Yeah.
So there is a lot of things that which you should understand for lifestyle. Nutritional aspect is one important thing, Fuzel. I'm seeing a lot of youngsters skipping meals just to become thin.
Yeah.
See, there's a lot of balance. I believe you should be able to focus on that too. Lot of youngsters, they think skipping meals can reduce their carbs.
Yeah.
And then, they can become thinner. But they should understand when they become thinner, their hairs are also becoming thinner.
Exactly. And also, it's become a trend now. 5-6 years ago, fat was the culprit. Now we learn to accept that fat is essential for our functioning. And now suddenly carbs have become the culprit. And I'm pretty sure we'll reach a point where people will badmouth about protein also. There is a reason I firmly believe that these macros exist is because they are meant to be used by our body. Everything has a place. And now also people overlook all of this. There are two things that I wanted to touch upon. One is they feel buying one particular product and using it for their hair or skin will fix up all the issues that they're doing.
Nope.
That will not happen. And second thing is they are hesitant to better their lifestyle, thinking it's going to cost them a fortune. But at the end of it, when you do create all these problems for yourself and then seek medical help, that's when you're actually losing a fortune. That's when you're actually buying yourself more stress.
Yes.
So fixing these things right in the initial stage is only going to do better for you in the long term.
I'll accept that, Fazil. I'll tell you that. What happens is in my consults, I'll tell my patients that it's a genetic issue, and second is your lifestyle, third is the nutrition, and fourth is a hormonal. And I tell them frankly that hormonal and genetic reasons, you cannot really influence them.
Yeah.
Now, the other thing is, when we are saying about hormonal and genetic, the lifestyle and the nutrition are preponing it. I tell my patients upfront, if you are not going to change them, my medicines are not going to work. A very clear statement there, because unless you change your lifestyle, you will not be able to control hair fall. See, a person is sleeping at 2 a.m. in the morning. How can you expect the hair loss to stop?
Exactly.
I tell them upfront, if you're sleeping at 2 a.m., forget about treatment, you will lose your hairs.
And also this common misconception. You obviously try to fix things on the inside, which is why you give them tablets that try to compensate their deficiencies. But still they come with that mindset, they want to apply something externally.
No.
They feel only that works.
Nothing works, Fuzel. I tell them very clearly. I see youngsters, 12 years old, losing hairs. Yes.
12-year-old.
I've seen the youngest 6-year-old girl losing hairs drastically. Her iron level was so low. The diet has gone for a toss. The diet nutritional value has gone for a toss. Everybody is looking at caloric value.
Yeah.
Rather than looking at the nutritious value. That's a very scientific aspect that they should look at. I was going through this Google, what is the calorie of this? What is the calorie of this? What is the calorie? Excuse me. You should not look at calories. You should look at nutrition. And then how much you're burning your nutrition.
Yeah.
What you take for nutrition, how much excess you have taken, you should burn your exercise, burn through your exercises and routines. How you can do without that? That's how people should perceive it and people should look at it. The best thing for hairs is a very good diet and a very good lifestyle. If you are not looking at a diet and a lifestyle, the hairs won't grow at all. I can tell you very, very clearly.
Very similar to what you told me the last time I had visited you. You don't make time for hair, the hair won't make any time for you.
No. But yes, I have seen many people, Fuzel, successfully they change their diet, successfully they change their lifestyle, and it's been a wonderful result for them. And it's been a beautiful, so many patients come back and tell me after a year or two, Doc, I changed my lifestyle. And then I got my good diet. I grew my hairs very nicely for 1 year. Last 1 month, this was my financial year ending. Everything went for a toss. You give me medicines, I'll change my lifestyle for sure. And then again after a year, they come back and they tell, yes, everything is fine. I just came for maintenance. It's rewarding for the doctor as well. It's rewarding for
I
the
was just
client.
going to come to that. In one of my previous podcasts, I had another doctor with us, nephrologist, your good friend, Dr. Ravi Andrews. So he told me there are two types of satisfaction for doctors. One is job satisfaction, and the other one is satisfaction as per a doctor. So in his case, we were talking about cases where the patient doesn't make it. So for him, job satisfaction is when the patient who is about to lose their life comes back and walks back home. But the real satisfaction is when the patient doesn't make it, but as a doctor, he knows that he's given it his 100%. So in yours, there's hardly any life and death situation.
Yes.
So what would you define your two satisfactions as job and as a doctor?
Well, as a doctor, I will say that when patients come back and tell me, thanks doc, I got a good skin, and thanks doc, I got a great hair, that's the best thing that we can hear for. And that makes our day. Yeah. And we give our 100%, that's for sure. And we don't guarantee results like saying 100% surety, warranty. I tell my clinics, my patients my clients very clearly, no warranty, no guarantee, no sureties. Don't expect 100%. None of my staff in my clinic say 100%.
Yeah.
So that's what we. But if you ask for my commitment, my dedication, my staff's dedication, 100%. That's going to be there. But I expect the same thing for my client too. To do 100% dedication
it's a
for
synergy of everything.
Yeah, who's the ultimate benefactor? Client, they get excellent hairs, they get excellent skin. I'm happy. That's how it is.
So in shorter format, if you say it, your patients are your walking visiting cards, right?
Yes, they are.
Your work is on display all the time.
Yes, they are. A good client, brings me like, 10, 20 clients, 10, 20 patients. And those patients, when they come back to us, a person with word of mouth,
But does that also put a lot of pressure on you saying, my friend has recommended and they have got the results? No, I am coming to you, so you need to give me the results faster.
We are through those pressures. We tell them clearly whether they require it or not. We tell them. Yesterday itself, one patient came to me and told me, I wanted a punch excision for my acne scar. And I said, wait, I'll do punch excision for you, but it's not going to benefit you. It will not give you much benefit.
This is another drawback of social media. I feel they come to you with diagnosis and treatment.
Oh, wonderful. I tell you. Now, I'll tell you one thing. There's a change. Earlier, patients used to Google up. Now they're doing ChatGPT. Now they're coming with ChatGPT. Okay, papillary lesion on my leg, cancer, write an essay on that in 1,000 words. They keep writing everything. So, in 10 minutes, they get every information.
You're basically like a pharmacist of sorts. They come to you with treatment. They take your approval and that's done.
No, I keep writing on my prescription, Fuzel. Clearly, stop Googling. I tell them that, those patients who are Googled up, who come back with that knowledge of Google, I kind of diagnose them earlier itself. They're anxious, a patient, earlier, I'll tell you one thing, a client came to me and he said that he was sweating all throughout. There was AC inside. He was sweating and he was anxious. There I have dandruff. Seen very mild dandruff, mildest of the mildest. I said, it's okay, you can go. Sir, is there anything else? I said, what? There's anything else that I should look for? Any blood test? Dandruff and blood test? No, nothing is required. No, I think we should go for blood test. We'll do routine screening, we'll do viral screening. Excuse me, what's happening? You tell me, what is there? He's like, no, I think that I might have this disease, I might have that disease. I was like, 1 second. How much time you spend on Google? Sir, every day morning and evening I'm spending time on Google. I said, don't stop Google. Because with Googling, ultimately any disease you take, Fazil, you take any disease. After Googling up, they'll think that the problem has come because of either cancer or HIV, or reading these two, they'll end up in depression. So Googling up is a big headache. I encourage my patients and clients to go to informative websites. Rather than
or even better, they can just approach a practicing person like you.
Fuzel, in the Western countries, the appointment of a dermatologist takes at least 3 months' time. Here it's just a call away. Doc,
exactly.
I'm coming down. You just wait for an hour or two, and then you meet him. Why do you have to go to Google? But in some times, this troubles us. But most of the times nowadays, the audience, they are becoming mature enough just to realize what is right, what is wrong, and they're opening up to the dermatologist's decisions. So they come up to me and tell, Doc, I want PRP, and then I say, no PRP, no GFC is better. Okay, whatever choice you say, but I want some procedure. That's how people are changing. That's a good thing, They move for the procedures. When I tell them punch excision is not good, this is a better choice. And they say, okay, you are the expert. That's how it is. But I request, Fuzel, through your platform, I request my patients, don't go to ChatGPT, don't go to Google, don't go to these things, Make your time, trust your dermatologist, discuss with them,
Takes just a few minutes.
Yeah. It takes time. It's not like an emergency that you grow your hairs in 15 years or so. That's how it is.
So, thank you so much for taking out time from your very busy schedule and
any day, Fuzel,
being
for you,
on our show. And one small question for you. From this whole experience, I'm pretty sure this was your first podcast, right? So from this experience and the interaction, what would be that one thing that you take away with you from today's session?
That's a difficult thing. Inspiration, Fuzel. A young guy like you is doing a great job.
Thank you so
I think that's an inspiration that I can take. Well, I hope you like this podcast. Fuzel was a very nice guy. I knew him from several years, and he was very much talking about skin and hair, doctor. Skin and hair, this is what is more important. So I thought probably we should talk about diet and lifestyle and the way that skin has changed, hair has changed, people's perception has changed. I hope you like this video. If you like it, definitely like it up. Share it to your friends who might require these kind of informative videos, and subscribe to Fuzel's channel. It's a really nice one. I subscribe to him and I'm getting those nice podcasts.
Thank you so much. And guys, if you did really like our podcast today, then please do like, share, comment and subscribe to our channel. And don't forget to press the bell icon to be notified whenever we come out with a new video.